This video is going to talk about post-dates pregnancy and the choices you have in your care during this time period. So post-dates is when your pregnancy goes past your due date. So your due date's at 40 weeks, post-dates is between 40 weeks and 42 weeks, and then 42 weeks is the end of a normal term pregnancy. So if you go past 42 weeks, that is a post-term pregnancy. The majority of people will go a little bit past their due date. It is often underestimated. For first babies, statistically, you have your baby around 40 weeks and 6 days, so that's almost a week. For a second baby, 40 weeks and 3 days. Going past 42 weeks is thought to happen to about 6 to 8% of people. You have some options about your care after you go past your due date, specifically about how to manage the 41st week of pregnancy. The choices are about managing the small increase in the risk of stillbirth and meconium aspiration syndrome as your pregnancy progresses into the 41st week, versus the risks associated with induction of labor. For more information about induction of labor and meconium management, please watch the Common Interventions video. The risk of stillbirth in a healthy pregnancy at this stage is low. At 40 and 41 weeks, it's about 0.3%, and at 42 weeks, it rises to about 0.5%. So it is a small increase in a small risk of a very big thing. This risk of stillbirth and meconium aspiration syndrome is thought to occur as the placenta ages and does not function as well as it needs to provide for your baby with the nutrients and oxygen that it needs. However, it's not like a switch flips and all of a sudden at 41 weeks your placenta is expired. Everyone's body is different, and most of the time your placenta does a fine job until you no longer need it. So your basic options are that you can choose to induce your labor at 41 weeks and 1 day when we know that that risk factor we were talking about increases a little bit, or you can choose to wait for spontaneous labor with an induction planned at the end of a normal term pregnancy, which is 42 weeks. The community standard of care here is to have that 42-week outside date for induction, but sometimes people will choose to decline this as well. If you choose to wait past that 41 weeks and 1 day first option for induction, your midwife will schedule a couple of ultrasounds to assess how the placenta is functioning, and if your baby is happy to wait a couple more days for your labor to start. If there is any indication on those ultrasounds that the placenta is starting to age, like the amniotic fluid is reducing, then we offer to induce you at that point rather than continuing to wait. The Association of Ontario Midwives does not recommend home birth after 43 weeks. Please talk to your midwife about your individual clinical history and pregnancy and make a plan that you feel good about. I am sure that you are eager to learn about ways that you can help prevent yourself from still being pregnant at 42 weeks and ways to help get your body ready for labor. So there's a bunch of things you can start doing once you're about 37 weeks pregnant, once you're term, to help get your body ready. You can eat dates, eat about 600 to 800 grams of dates a day, drink red raspberry leaf tea, as much of it as you want. Eat lots of pineapple and papaya or spicy food if it is not a part of your normal diet to get your gastrointestinal system moving. Go for a nice walk every day to get your baby in a good position. Some people swear by acupuncture. You can try this too. Sex is also a really good way to encourage labor. There are a couple of reasons for this. If your partner has a penis, there are prostaglandins in semen that help soften your cervix. If you do not want to have penetrative sex with a penis, orgasm and nipple stimulation both release oxytocin, which is the hormone that causes uterine contractions and can be achieved by external or self-stimulation as well. You may have heard about stretch and sweeps. This is when your midwife does a vaginal exam and stretches the cervix, sweeping it away from the membranes of the amniotic sac. What the evidence shows us about these is that if you do them routinely for 8 people starting at 38 weeks, you will prevent one of them from going past 42 weeks. The evidence does not show that they help us avoid a 41-week induction date. They are not a magic labor button, unfortunately, although if you are on the edge of labor anyway, they may just nudge you over. Your cervix must be open enough to do them, so especially if this is your first baby, we may be more successful as you get closer to your due date and your cervix starts to change on its own. They are subject to the availability of your midwives. If the sky is currently raining babies, your stretch and sweep may be postponed until there are midwives available to catch your baby. If you are Googling concoctions to get your labor going, you may read about taking castor oil. I have seen a few people do this effectively to help get contractions going, but if your body isn't ready, it mostly just gives you enthusiastic diarrhea and a lot of cramps. So talk to your midwife about when would be the best time to use this if you plan on it. So I have put some information for you to read in the descriptions below. Please have a look and discuss your plans with your midwife as you get closer to your due date. In general, we like to know what you're thinking and what your plans are by about 38, 39 weeks so that we can book any ultrasounds that we may need to for you in the 41st week if you are choosing to wait a little bit for your labor to start.